Everyone, I'm really excited about bringing on my next guest, who is Dr. Micah Olson. He is the owner of Valley HEALTHSPAN. Welcome to the show. I want you to tell everybody, first I have to ask this, tell us a little bit about yourself and what you do.
Thanks, Carol. It's great to be here. I am the owner and founder of Valley HEALTHSPAN. I started Valley HEALTHSPAN about 2 years ago. I spent 14 years of my medical career at Phoenix Children's Hospital as a pediatric endocrinologist, and I got several years in, got mid-career, had a great career at Phoenix Children's, loved it there, but some circumstances in life led me to take a different interest in my medical career, and we'll go over that, but that led me to start Valley HEALTHSPAN, and we've been seeing patients now for 2 years.
You want to talk about your mom?
Would love to. So my mother was diagnosed with Alzheimer's disease in her early 60s. She passed away a few years ago at the age of 70, but she had a very early onset of Alzheimer's. And in the course of her evaluation, she was discovered to have a very high genetic risk. There's a gene called the ApoE4 gene, and about 25% of the population has one copy, and about 1% of the population has 2 copies of that gene. If you have one copy, you have about a 2 to 3 times increased risk of developing Alzheimer's in your life compared to the general population. If you have 2 copies like she had, you have about a 10 to 15 times increased risk. And in fact, your lifetime risk is over 90% of developing Alzheimer's. And so she had the 2 copies. It's called homozygous. And so in discovering that, I knew that my own genetic risk was higher. Thankfully, I just have 1 copy. I'm what's called heterozygous, so my risk is 2 to 3 times the general population. But as I learned that, I thought to myself, I'm healthy, I'm in my 40s, what can I do now at this stage of my life to help me to not go down the same road that she went down and prevent Alzheimer's disease?
So it's all about anti-aging for you.
Well, so I started to ask a question that a lot of people are asking in medicine, which is, what can we do earlier in life to help us to keep our cognition as sharp as possible as we age? And not only that, that really bleeds into a question of, what can I do early in life to help me to have the most physical function, quality of life, cognitive function, and really set us up to live with as much vitality as possible? That's a question that a lot of people right now are asking, and it really is a different mindset than what traditional medicine looks at. Traditional medicine will say, well, what can we do to treat your illness right now? And the type of medicine I practice now is, how can I help somebody to avoid illness? How can I help you to live a life where you're free of chronic illnesses? And not just that, but have the most physical function and just overall vitality and quality of life as you can. And that's exactly our mindset at Valley HEALTHSPAN.
That's awesome. Now, you're located just at 32nd Street in Camelback. Their website is valleyhealthspan.com. The phone number is 480-973-9042. And some of these, I'm going to go in some of these questions that you have here. So we're hearing a lot about hormone replacement these days. Why has there been such an resurgence? How do you say that?
Resurgence.
You say it, not me. Go ahead. I'm glad you did. Okay. Or the interest in it. Go ahead.
Absolutely. So this is a long story, but really the nuts and bolts of it is, there was a huge study that was published about 20 years ago called the Women's Health Initiative, WHI. It was to date by far the largest study that's been done of hormone replacement therapy in women. And prior to the study, the medical community was quite pro-hormone therapy. There was a number of potential benefits that were well known in the research studies that had been published. But this study kind of changed everything overnight. The initial results from this study were quite negative. There was things about the types of hormones they used in that study that got people scared. There was a link to breast cancer and also a link to increase in blood clots. And overnight, the medical community just kind of the pendulum really switched to a negative approach to hormone therapy. And for the last 20 years, that's really dominated the conventional medical community and what doctors get in their medical training. And I would say over the last 5 to 10 years, there's been a couple things that have really changed that mindset back to a really changing back to a positive approach. Number one is simply that the long-term results of the Women's Health Initiative have looked way, way better than the short-term results. Now, that has not received the same headlines as those initial results did 20 years ago, but that's caused a lot of doctors that have looked at the long-term results with kind of a new eye to say, wait a second, maybe we got this wrong in the first place. The second, I think even more important reason is when they designed this study, the WHI, they designed it in the early 1990s. Medical research takes time. It took about 10 years to complete the study and get the initial results. And in the early 1990s, all they knew to use from a hormone standpoint are what we today call synthetic hormones. They used a synthetic form of estrogen called Premarin, which is actually estrogen from pregnant mares, pregnant horses, and it's similar to human estrogen in some ways, and it causes a lot of the same benefits, but it also causes additional side effects and complications that human bioidentical estradiol does not cause. And the same is true for the other hormone called progesterone. They used a synthetic form of that, and that's really all they knew to use in the early 1990s. And it was those two synthetic hormones that caused a lot of the negative, the breast cancer and the blood clot risks. So now we know today that as we use bioidentical hormones, which is really commonplace, has become more and more commonplace in the last 10 to 20 years, it's all the same set of benefits, probably even more beneficial, but the risks are just simply not there. That's been well characterized in many additional research studies. And so the risk-benefit ratio has changed dramatically from what we first thought when the study was first published 20 years ago and all the negative press that was received. And we do it differently. We do it with different hormones. We do it with more so-called natural hormones, bioidentical hormones. And we just know a whole lot more about the long-term results that has put a much more positive spin than we thought originally 20 years ago.
And with hormone replacement, it's both for men and women.
There's no doubt about that. I would say that it is more complicated for women, believe it or not. A very high percentage of our patients are women, but men also, they do not go through as dramatic of a decline in hormones in middle age as women do with menopause, but men go through something called andropause. And their testosterone levels decline slowly but surely, not over the course of 1 or 2 years, but over the course of a lifetime. And so every decade, the normal course of things is for a man's testosterone level to go lower, lower, lower. And there's also really a different mindset on testosterone replacement therapy today than there would have been 20 or 30 years ago.
Now, again, you can check him out on his website. It's valleyhealthspan.com. The phone number is 480-973-9042, located at 32nd Street in Camelback. So you treat a lot of patients for weight loss, but you always say that you care more about body composition than weight. What do you mean?
Well, weight's an easy thing to measure. It's it's where our minds always go. It's the kind of the first thing that people think about. But at the end of the day, we tell patients weight is maybe correlated with the results we really care about, but it's not, it's a means to an end. And the results we really care about is how healthy you are, what's your metabolic health, what is your physical function, and so on. And that is much more nuanced than just weight. So, for instance, we really coach our patients to add muscle mass. And what do you do when you add muscle mass to your weight? Your weight goes higher. And so if you're just looking at the scale as your only metric, you're actually working against yourself. But of course, so it's in that sense that we don't care what the scale says. We're working with our patients to increase muscle mass and then decrease body fat, and specifically a type of body fat called visceral fat that really is by far the most metabolically harmful of the regional fat in our body.
When you work with people and you're dealing with, because a lot of times hormones cause, weight problems, right? Hormones, if your hormones are out of whack, it can
absolutely, yeah. Replacing hormones can be extremely impactful in a positive way for body composition.
Right, and losing weight. Everybody's wanting to lose weight and doing it without having to, do all the work, right? So, but when you work with them, do you, do they come in to you without like on a weekly bi-weekly? How does that work?
Boy, we treat every patient differently, and really it's a matter of getting to know them, what their needs are, what their goals are. And so we don't have a standard approach for every patient. We have a highly individual approach, but we have a conversation where we'll discuss all the various methods. For sure, there are weight loss medications now that we did not have 5 or 10 years ago that are highly effective, but we'll look at the whole picture: nutrition, sleep, exercise, medications, and discuss their options.
It's all about living healthy, right? And living longer as long as you can. Again, that phone number is 480-973-9042.